All right, today we are diving into a really big deal in the world of oncology. It's a major clinical trial, hot off the presses from the New England Journal of Medicine, and it could totally change how we fight one of the toughest forms of stomach cancer. Okay, let's get right into it.
So first things first, we've got to understand the opponent we're up against. We're talking about something called HER2-positive gastric cancer. Basically, for up to 1 out of every 5 people with stomach cancer, their cancer cells are covered in this protein, HER2. You can think of it like a stuck gas pedal, just telling the cancer to grow and spread fast. And that makes it a real challenge to treat.
So here's the problem. Doctors have a standard go-to treatment they use first. But cancer can be relentless. What happens when that treatment stops working and the cancer starts growing again? What's plan B? That's the million-dollar question, and it's exactly what this trial, called Gastric04, set out to answer. They needed to find a better second line of defense.
And that sets the stage for a real showdown. This wasn't just a simple study. It was a direct head-to-head fight. In one corner, you have the current standard treatment, and in the other, a brand new challenger.
Okay, so let's meet our contenders. The challenger is a drug called trastuzumab deruxtecan, or TDXD for short. The best way to think about it is like a smart bomb. It has an antibody that's basically a heat-seeking missile for that HR2 protein on the cancer cells. And once it locks on, bam! It delivers a powerful chemo drug right inside the cell. It's incredibly precise. The standard, on the other hand, is a 2-drug combo that takes a different approach. One drug tries to cut off the tumor's blood supply, while the other is a more traditional chemo. So 2 very different game plans.
So now for the main event, the results. You know, in any cancer trial, there's one question that matters more than anything else. Does this new treatment help people live longer? That was the #1 goal here.
And the answer? A resounding yes. Just look at the difference. Patients on the new drug, TDXD, had a median survival of almost 15 months. The standard therapy, just over 11 months. Now, that 3-month difference might not sound like a lot, but in the world of advanced cancer, that is a huge, meaningful leap forward. It's the kind of result researchers hope to see.
But you know, that median number is just the halfway point. It doesn't really give you the full picture. The real story, the thing that gets really exciting, is what happens when you look further down the road, at the long-term survivors.
This number, 29%. Just let that sink in for a second. This, right here, might just be the most hopeful, most powerful figure to come out of this entire study.
So what does that 29% mean? It means that after 2 full years, almost a third of the patients on the new drug were still alive. Now compare that to the standard treatment, just under 14%. That's more than double the number of people alive at the 2-year mark. That's not just a small improvement, that's a profound, long-term benefit.
But of course, with any powerful new weapon, you have to ask about the trade-offs, right? It's never just about how well it works. You have to look at the other side of the coin. What are the side effects? What is the cost to the patient?
And what the data shows is that, yeah, side effects were pretty much a given. More than 90% of people in both groups had them. So really, the question wasn't if patients would have side effects, it was what kind of side effects they'd be dealing with.
And this is where it gets really interesting, because each treatment had its own unique risk profile, its own, let's call it personality. The new drug, TDXD, was more likely to cause bad nausea. The standard therapy, on the other hand, had a higher risk of nerve damage. But the big one, the side effect everyone watches for with TDXD, is a specific kind of lung inflammation known as ILD.
And the researchers, they didn't shy away from this at all. They put it right out there in the paper, saying, and I'm quoting here, that this lung disease is an important risk that comes with the therapy. They're telling doctors, hey, you have to be aware of this and take it very seriously.
Okay, but let's break that down, because context here is everything. Yes, about 14% of patients on the new drug got this lung inflammation, but, and this is a huge but, almost all of those cases were low-grade and manageable. And this is really important. In this trial, there were 0 fatal cases of ILD in the TDXD group. In fact, the standard therapy group actually had 1 fatal case. So what this tells us is that while the risk is real, it's a manageable risk as long as you're watching for it.
So where does that leave us? You weigh the incredible survival benefit against these known, manageable side effects. What's the bottom line? What does this victory for the challenger really mean for patients and doctors?
Well, the verdict is pretty clear. TDXD won. And it didn't just squeak by. It was superior across the board. Patients lived significantly longer, it took longer for their cancer to get worse, and it was much, much better at actually shrinking the tumors. I mean, a 44% response rate versus 29%, that's a clean sweep.
And that brings us to the ultimate takeaway from the authors themselves, which is really the mic drop moment of the whole paper. They conclude that TDXD may be the preferred second-line treatment option. That's not just a suggestion, that's a practice-changing statement. They are effectively establishing a new standard of care.
And, that just opens up a whole new, exciting question. If this smart bomb is so incredibly effective as a backup plan, a second line of defense, what if you used it first? Could this become the new frontline champion in the fight against HER2-positive gastric cancer? That's the next chapter researchers are already starting to write, and you can bet we'll be watching.